Alopecia areata is a disease characterized by hair loss that develops when the body attacks its own hair follicles, which are where hair grows from. This can cause hair loss anywhere on the body. Alopecia areata can affect your scalp or your entire body, and it can be temporary or permanent. It can be the result of heredity, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it's more common in men. Hair loss can appear in many different ways depending on what's causing it. It can come on suddenly or gradually and affect your scalp or your whole body. Your hair loss can begin at any age. However, most people develop it during childhood or their teenage years. About half of them see their hair regrow within 12 months without treatment. When the hair regrows, it may never fall out again. It's also possible to have unpredictable cycles of hair loss and regrowth for years. Hair loss is mainly caused by one or more of the following factors: family history or heredity. The most common cause of hair loss is a hereditary condition that happens with aging. This condition is called androgenic alopecia, male pattern baldness, and female pattern baldness. It usually occurs gradually and in predictable patterns, which is a receding hairline and bald spots in men and thinning hair along the crown of the scalp in women. Hormonal changes and medical conditions. A variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Medical conditions include alopecia areata, which is immune system related and causes patchy hair loss, scalp infections such as ringworm, and a hair pulling disorder called trichotillomania. Medications and supplements. Hair loss can be a side effect of certain drugs such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. Radiation therapy to the head. After submitting to radiation therapy to your head, the hair may not grow back the same as it was before. A very stressful event. Many people experience general hair thinning several months after a physical or emotional shock. This type of hair loss is temporary. Hairstyles and treatments. Excessive hairstyling or hairstyles that pull your hair tight, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. Hot oil hair treatments and permanents also can cause hair to fall out. If scarring occurs, hair loss could be permanent. Poor nutrition. An unhealthy diet is known to be one of the reasons why someone may experience hair loss. People typically lose 50 to 100 hairs a day. This usually isn't noticeable because new hair is growing at the same time. Hair loss occurs when new hair doesn't replace the hair that has fallen out. Here are some signs and symptoms of alopecia areata or hair loss. Gradual thinning on top of the head. This is the most common type of hair loss affecting people as they age. In men, hair often begins to recede at the hairline on the forehead. Women typically have a broadening of the part in their hair. An increasingly common hair loss pattern in older women is a receding hairline, also known as a frontal fibrosing alopecia. Circular or patchy bald spots. Some people lose hair in circular or patchy bald spots on the scalp, beard, or eyebrows. Your skin may become itchy or painful before the hair falls out. Sudden loosening of hair. A physical or emotional shock can cause hair to loosen. Hands full of hair may come out when combing or washing your hair, or even after gentle tugging. This type of hair loss usually causes overall hair thinning but is temporary. Full body hair loss. Some conditions and medical treatments, such as chemotherapy for cancer, can result in the loss of hair all over your body. The hair usually grows back. Patches of scaling that spread over the scalp. This is a sign of ringworm. It may be accompanied by broken hair, redness, swelling, and at times oozing. When it comes to determining the kind of treatment, dermatologists distinguish the type of alopecia areata that someone has. Here are the main types of hair loss. Alopecia areata. Alopecia is the medical term for baldness. Areata means patchy. This patchy baldness can develop anywhere on the body, including the scalp, beard area, eyebrows, eyelashes, armpits, inside your nose, or ears. Alopecia totalis. This is when a person loses all hair on the scalp. so the scalp is completely bald. Alopecia universalis. In this case, the person loses all hair, leaving the entire body hairless. By the way, we rarely see this happen. Most baldness is caused by genetics, which is male pattern baldness and female pattern baldness. However, this type of hair loss is not preventable. Here are some tips that may help you avoid preventable types of hair loss. Be gentle with your hair. Use a detangler or avoid tugging when brushing and combing, especially when your hair is wet. A wide tooth comb might help preventing pulling out hair. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, and permanents. Limit the tension on hair from styles that use rubber bands, barrettes, and braids. Ask your doctor about medications and supplements you take that might cause hair loss. Protect your hair from sunlight and other sources of ultraviolet light. It is advisable to stop smoking. Some studies show an association between smoking and baldness in men. If you're being treated with chemotherapy, ask your doctor about a cooling cap. This cap can reduce the risk of losing hair during chemotherapy. You may be asking right now, how can I avoid getting my hair to fall out? I've got you covered. Watch this video on the right side to discover some natural ways to treat alopecia areata. If you got value from this video, don't forget to hit the like button and subscribe to the channel so you never miss out on any new videos uploaded. Remember, your health is your priority. I'll see you in the next informative episode.